Dr. Beth Niehaus, Associate Director of the Informatics in CDC's Influenza Division, provides tireless and innovative leadership for a variety of informatics and advanced computer technology projects. So these are some of the people that are working every day to make sure that you know about the flu. So what we're going to do right now is we're going to have a word from one of our sponsors, and we'll be right back. So if you have questions, comments, we're going to continue with the show. We're going to share next, during the next portion, second portion of our show, some of the ways you can protect yourself against, to prevent yourself from even getting the flu. And if you just decide that you're not getting the flu vaccination, the influenza vaccination, then we have some tips on what you need to be doing. Stay tuned.
Let's be creative with Carrie. Caricatures by Carrie, available for weddings, parties, anniversaries, corporate events, and more. Children's book author, superheroes, and cartoon illustrator, logo and graphic designer. Contact Carrie for your customized creations. Caricatures by Carrie at gmail.com. Connect on Twitter and Instagram with hashtag CaricatureCarrie and check him out. www.carriegjohnsondraws.com.
And we are back. You're listening to Partners in Health and Biz on the PIH Radio Network. I'm your host, Gail Dixon. So happy you could join me this morning. Very important show. This is National Influenza Vaccination Week, and on and beyond. Did you know, even without a flu shot, you can still do something to protect yourself? Most seasonal flu activity typically occurs between October and May, but it most commonly peaks between December and February. So what are you going to do? To dodge the illness, you should get a flu shot. There are available alternatives to standing in line or paying exorbitant prices to get this flu shot, such as good hygiene or antiviral medications, which, of course, that is recommended in the first place. There's flu mist. Flu mist. What is flu mist? Well, flu mist is a nasal spray vaccine and is generally recommended for healthy persons who are age 2 to 49 years and are not, I repeat, are not pregnant. So the flu mist is a needleless option for people 18 to 64 years old. The jet injector vaccine with Afuria, which uses a tool with high pressure to deliver the vaccine. So if you are afraid of needles and you want to be protected and not get a shot, but you want to be protected against the flu, then your option would be flu mist if you are between the ages of 18 and 64. So what about preventing the flu without shots? So short of getting the flu vaccine, there are many steps you can take to lower your risk of getting the virus. And we're going to be calling it respiratory hygiene, according to Walter Stamm. Dr. Walter Stamm is the professor of medicine at the University of Washington in Seattle. He's also the president of the Infectious Disease Society in America. The most important thing you can do, Dr. Stamm says, is to wash your hands frequently. You should be amazed how often adults, not just children, put their hands in their mouths, he says, although the flu virus is airborne in droplets of breath. The majority of it is probably passed by hand, according to Dr. Stamm. Now, the Joint Commission on Accreditation of Healthcare Organizations has joined with a raft of other medical professional groups to recommend 3 easy steps to prevent infection with the flu, especially during a time when there is a shortage of flu shots. So 1, clean your hands for 15 seconds. Use soap, warm water, and a period of vigorous rubbing will wash viruses down the drain. Do this every time you sneeze or cough, and especially before meals. Those alcohol-based hand cleansers are also good to have around the house or in a pocket or purse. And of course, beware, washing your hands, especially during the winter, is definitely recommended. However, you want to remember that your skin will tend to dry out, especially if you are using those alcohol-based hand cleansers. So you're going to have to moisturize. Second, cover your nose and mouth when you cough or sneeze. I know this sounds like everybody should know this, right? But some people don't. Even if you don't have a tissue, use something to cover your mouth or nose. Use a tissue rather than a cloth hanky, or cough into your sleeve and the crook of your arm. Then wash your hands. The advice may be aimed at keeping viruses off your hands. Vincent Snow, Dr. Vincent Snow is the Director of Clinical Programs for the American College of Physicians, and he's telling this to WebMD. Avoid close contact. Yes, if we have to go out in the public unless you have a work from home job where you don't have to be in the public. If you are in the public, then Stam jokes that this advice means fly first class. In a more serious vein, you should avoid crowded public places. And if you do feel ill, flu is characterized. How do you know you have the flu? Well, flu is characterized by rapid onset of fever, chills, and horribly aching bones. If you've ever had the flu, you know what it feels like. It's not pleasant. It's very uncomfortable. So it's different from a cold. Stay at home or keep your child at home. That's right. If you know you have the flu or you have these symptoms, then you probably have the flu. Stay at home. Keep your child at home. You don't want to send them to school so they can contaminate other children. It's very important that they stay at home until the fever is gone, the chills are gone, and they're not aching. Do not go into work. I repeat. So many people feel like, I'm so dedicated, I have to get in there. What will they do without me? I repeat, do not go into work. You're going to contaminate your coworkers. Do not even run to the emergency room unless you have trouble breathing or sky-high fever develops. Well, you want to go, but put on a mask over your mouth and wear gloves or whatever. Definitely don't want to contaminate a lot of innocent people. Some people are in the emergency room for cuts and broken bones and things, and they don't need to have the flu on top of all of that. In the hospital, you and your family will be surrounded by infectious people. Yes, you will. People with the flu feel so terrible that they usually don't go anywhere. Okay, so those are some of the things, and we have other ways that what you can do. Other recommendations, and I want to give out the call-in number. We have about 7 minutes left before the end of the show. If you have questions or comments you want to address, you can call into the show 347-945-7433, 347-945-7433. Press 1 if you have a question or comment, and you don't have to do anything if you just want to continue to listen to the show. Other recommendations include getting plenty of rest, eating a healthy diet. What is a healthy diet? Fruits and vegetables, lots of water, getting lots of fiber, drinking plenty of fluids, and getting plenty of exercise. Of course, if you have the flu, you want to not exercise as much. You want to rest as much as possible. And so those are some of the things. And also, can we tell you to do? According to the American Council on Exercise, research has shown that moderate exercise, such as a brisk walking, brings about measurable changes in the immune system, sending white blood cells zipping around the body to find intruders and killing them. But after a few hours, the immune system returns to normal, so it's best to exercise regularly. And so Dr. Rita Bedford, she's a spokesman for the American Council on Exercise, also cites that studies that show that those who exercise 4 to 5 times a week are less likely to get colds or other viruses. So these are preventative things that you can do. You're going to be exercising and walking out and getting some fresh air and sunshine. Remember vitamin D. Vitamin D is a protection to protect your immune system, to build up your immune system. During the winter, what happens? Most of us, when it's cold outside, we don't want to be cold, so we stay inside. If you're inside, most of the time, and especially during the winter, we have many cloudy days, overcast days where the sun is barely out, and especially if it's snowing, sometimes there's no sun. There's sun out there, but you can't. It's not as much, and so you're not getting the vitamin D if you're indoors and you're not outside. So try to get, even in the wintertime, try to get out and take at least a 15 to 20-minute walk, even if it's just around the neighborhood, so you can be exposed to some sunshine for the vitamin D that is going to help build up your immune system. Most healthy people will recover from the flu in 7 to 10 days, and luckily the worst symptoms go away within 4 days. Most drugstore regimens aim to lessen those symptoms. So those are some of the things that we offer you here at PIHradio.net, things that you can do to prevent the flu, and also to prevent the flu if you don't want to get the flu and you want to also do things that are natural to help you to prevent the flu. And then, of course, the flu vaccination, influenza. So, again, flu vaccination coverage estimates that past seasons have shown that few people get vaccinated against influenza after the end of November. So we don't want you to be one of those who said, well, I didn't get the flu vaccination, it's too late, or I should just do some things that can, keep myself from getting sick. You want to be doing those things in the first place. Drinking plenty of fresh, pure water, and making sure that when you are out, especially in public, you try to stay away. Try to avoid the public as much as possible, but you can't do that, especially all the time. For those who have jobs in the city and they catch the subway or the train, you're going to be surrounded by people in close proximity, people who are probably coughing and sneezing. And what can you do? Well, you can get a flu. You can be vaccinated against the flu. You can wash your hands and make sure that as soon as you are somewhere where you can, or if you have some sanitation liquid, you can use that on your hands. You can try to avoid any direct contact where someone is actually sneezing on you, where you would get a direct hit. You can make sure you get out and get that vitamin D and get your exercise. So there are some things you can do naturally. Lots of vitamins. Make sure you take your vitamins, your multiple vitamins, your vitamin C. Some recent studies have said that vitamin C does not prevent colds, but it can help with the immune system and other things, but mainly vitamin D, and eating lots of fruits and vegetables and fiber, getting that necessary fiber in your diet to make sure that your digestive system is strong. Many problems occur because of our sluggish digestive system. So we're just about down on time, ladies and gentlemen, boys and girls. I'm your host, Gail Dixon. Certainly hope I have provided you with information that's going to be helpful for you during this flu season. So until next Saturday, tune in to my partner Wendy Meyerhoff and her show, www.pihradio.com. All right, have a blessed day, everyone. Bye-bye. I'm your host, Gail.